Welcome to another edition of Disability and You. I'm Ganesh Singh and I'll be with you for approximately 30 minutes. On this edition, my focus will be on Alzheimer's and more so how it affects our older population. And here with me to share information on what is Alzheimer's, symptoms, signs, and who are at risk is Dr. Devindra Sharma, who is specialized in this area, and he's been practicing for a number of years. But I will not share much information. I'll allow Dr. Sharma to do justice to his biography. So, Dr. Sharma, welcome to the program. And before we get any further into our topic that we're focusing on, I just want you to tell the general public who is Dr. Sharma.
Well, thank you. Thank you for having me on very important topic. Yeah, my background is a doctorate in medicine from the University of West Indies and did my MBBS in Punjab. And I've been out to Guyana for many years, working as a head of department and professor in behavior sciences at a medical school in the Caribbean, Ross University. I'll be back in Guyana now about 4 years, and glad to be on the show.
Excellent. So, when you speak from a position of authority with years of experience in the field.
Yes.
Excellent. So, Dr. Sharma, this month is being observed Alzheimer's Awareness Month, and we want to do our part in helping to raise awareness on what is Alzheimer's, who are at risk, and what are some of the signs. So, tell us, what is Alzheimer's?
Alzheimer's is unfortunately a severe disease of the elderly, mostly, where we know that they lose memory and we call it a dementia. Many persons actually think Alzheimer's is the only form of dementia. It is the most commonest, or the most common worldwide. It affects everybody all over the world. So we're no exception. And then we have other forms of dementia like hypertensive induced dementias, what we call secondary dementias, and diabetes induced, what they call vascular dementias, and then some other degenerative conditions. There are some dementias that are reversible, but unfortunately, Alzheimer's is progressive. Hopefully, down the road, there are good signs that we could find almost a cure for it, or maybe the ways to stop it. So that's in a nutshell
What is Alzheimer's? So basically, when you hear within the communities, and I'm sure being in Guyana and working or practicing, you would hear people saying that this old or this elderly person is losing their senses, they're speaking nonsense, they're walking out of the house, things like that, without having an understanding that it's a disease. But they just keep saying that they're losing their senses. Is that the same?
Sometimes the person who loses memory would also lose orientation, and they may have the other difficulties. We know that dementia can be complicated by behavioral problems, emotional problems. It's a cognitive disorder, so it's really a disorder of mostly the frontal lobe of the brain. But the other areas of the brain involved, like the temporal and parietal lobes, especially in Alzheimer's, is mostly parietal, temporal, and to some extent frontal. So when the frontal lobe gets degenerated, the person's personality starts to change and the behavior would change. So it's a part of the unfortunate process that happens when people start to lose memory. So not just memory loss, many people think it's just memory. And it's not the same as what people would call senility, which is persons as they grow older would tend to lose some memory. This is clearly a defined disease process.
That's more severe.
With clearly determined parameters. For example, we look for neurological signs of the parietal lobe. So with those, along with problems, especially in the short-term memory, because long-term memory tends to be preserved, but the short-term, the ability to form new memories also goes. So you often will get additional problems where the folks may say that they are very disturbed, as you just pointed out.
But as you mentioned, there are clear parameters for the specialist to work within. So that is where proper diagnosis comes in.
Absolutely. So it's really important that we make the correct diagnosis, not only to know whether it's Alzheimer's, but also to know whether it's a dementia that's related to an underlying cause. See, Alzheimer's dementia is primarily genetic, but
Mm-hmm.
there could be, as I said, other causes, vascular problems in the brain, or other type of conditions, even like vitamin deficiencies, like B12 deficiency, is associated with dementias, and the B12 deficiency dementia is actually reversible,
Mm-hmm.
and then even severe depression, Ganesh, can also cause people to lose memory, and in the older persons, we may mistake it for Alzheimer's when it's actually a problem of the mood, depression.
Mm-hmm. And you mentioned that it's um, you meant a lot about older person. Are they the only category of adults that are affected by Alzheimer's or dementia?
Well, it's primarily a disease of persons around the starting point about age 65. So we usually see it commonly after age 65, but there are early onset dementias before age 65.
Mm-hmm.
But more commonly, you'll see it, the numbers, the prevalence rates will go up as the person ages or the persons in the society ages. So you'll see more numbers in the over 70 group. But you do see it in younger folks. I'm talking about people in their 50s may present with Alzheimer's, but not as commonly. There are memory problems of persons who are much younger, but usually it's not Alzheimer's, because Alzheimer's usually manifests by 50s early, but the first case of Alzheimer's was diagnosed in a 52-year-old man. So
Mm-hmm.
it could happen younger, but generally you would see it in the aging population. It's getting more prevalent because the populations are growing older with the medical care.
Yes. But I want to go back to some of the factors that can influence someone having dementia, Alzheimer's, or and so forth. You mentioned genetics being one of the main factors, but you also mentioned vitamin deficiency and so on. But what about our lifestyle as young people? What we consume, um, and how we live our lives, whether our physical activities and so forth. Are those factors to be considered from early on as young people, so that when we get to the age of 60, 65, we're not at such a high risk of developing dementia?
Well, for developing dementia, protective factors in the young would be healthy lifestyle, healthy diet, ensuring that the B vitamins are taken, because the B vitamins are critically significant for what we call myelin formation in the nervous system. And B12 is the most important of the vitamins. But B1 also is associated with memory problems, especially persons who drink excessively. So we do see a very strong correlation between heavy drug use, alcohol use. A lot of people think that marijuana is a very soft drug and it has some very calming effects, but it also has significant problems on the memory. So anytime people use these things, there's a consequence. So sometimes, of course, there's medical marijuana, and that's a uh, different form of treatment that's being used for treating cancer patients and so on. So there are medical benefits of drugs, the natural plants. But people who just use it and abuse these things can suffer consequences later on. And even something like cigarette smoking has consequences on the vascular system because the link to atherosclerosis is very high. So dietary factors, lifestyle behaviors, excessive alcohol use, cigarette smoking, marijuana use, well, of course, the other hard drugs, clearly very negative on the vascular system. So those are more linked to vascular related dementias. Alzheimer's, unfortunately, while we know the most protective factor is keeping that brain active,
Mm-hmm.
keep it learning, keep it focused on memory, even as we grow older, encourage the persons to keep the brain active, almost like exercise in the memory centers. We do unfortunately have the genetic predisposition. So if somebody is predisposed, there is a very strong chance that the genes will operate negatively. And what it does is start to produce abnormal proteins in the brain, and these proteins enter into the memory centers. They form tangles like hair tangles and disrupt the memory process. So we identify those genes.
Hmm. So basically, it's you trying to find or change your lifestyle, whether it's exercising the brain through brain teasers,
Yeah.
engaging in learnings, or even if you're older, it's never too late to learn and try to do some critical thinking and things like that, but also lifestyle changes so that we would not be at risk.
Right.
Um, Dr. Sharma, you also would have highlighted that we, I want to go back to the parameters. In Guyana, we tend to self diagnose a lot. And, we sit at home and because we do not look as mental health as important as our physical health, really when these things happen, like, persons would lose their memory and it, as you said, it's progressive. They don't take it as serious as they would if something happened to them physically. So do you find a lot of persons seeking um, your guidance, your diagnosis as it relates to the different forms of dementia?
Well, my experience in Guyana has not been so great where it comes to the understanding, as you said, of persons with brain disorders. It seems like people don't really take their brains very seriously. They would take other parts of the body more seriously, especially things like the gastric system and maybe problems with the heart with palpitations. They rush to the doctors for that. But with the brain, there seems to be a reluctance. Maybe it's associated with a lot of negativity or a big stigma against,
That is so true.
yes, persons with cognitive or emotional problems or behavioral problems. So it's not enough in terms of persons having the older folks being screened for the possibility of recoverable dementias. Of course, if we identify it as Alzheimer's, then we would educate the family that this is a progressive disorder and sort of help them to do the things like we talked about, the cognitive training, challenges to the memory system to encourage that person to still maintain or build some parts of their memory. So I think it's important that people overcome those negativities and seek their guidance, get the diagnosis made correctly, because diagnosis is made by a neurological examination within which we do cognitive examination and we identify the memory loss by numbers. So anything below 20 in that Fallstein score would be dementia. Along with that, we would find parietal lobe signs that persons would have because the parietal lobe is being damaged, and to develop some problems in terms of recognizing objects, being able to perform certain actions, and those are very strong clues to the true diagnosis. A CT scan will support and confirm
Yeah, I was just
the
going to ask
diagnosis.
about that. Yeah.
Yeah, but many people rush to do the CT scan, but the CT scan may not truly tell us what's the underlying cause of the cortical atrophy. So you really have to do a good clinical examination, take a full medical history, because you may pick up something that's still treatable. For example, even syphilis can present with dementia. It's called tertiary syphilis. And as I said before, the B12 deficiencies. So you want to look for those problems. Persons with uncontrolled diabetes that may not have been picked up before could suffer consequentially vascular damage to the brain vessels. And the brain vessels are very delicate. That's why we have the brain surrounded by this hard skull that we have. So those vessels are very fragile and easily broken if there's a lot of stress. So maybe also another negative factor that could have happened would be trauma to the head. So these persons who engage in violent sports got to be very
Yeah, I
careful.
just wanted to I wanted to discuss that a bit more. Dr. Sharma, if you can please hold your thoughts. We're gonna pause for a short break. When I return, we'll continue the discussion on our engagement in tough sports, if we want to use that word, or aggressive sports, and how that can affect us in our later years as it relates to dementia and so forth. Dr. Sharma, before we paused for that short break, you were discussing aggressive sports and how that can put us at risk of developing dementia later on. Could you elaborate a bit more on that?
Well, the link between head trauma and memory problems and dementia and also other areas of the brain being affected is clearly established. We see the sad spectacle of a great boxer, Muhammad Ali, suffering from Parkinson's disease and also losing memory. So, traumatic brain injury is not something that we want to see happen in our younger folks, because then it can carry on into the older ages where they now would pay the price for being involved in those sports. I'm not saying that we cancel the sports, Ganesh, but I
Yeah,
think the protection is very critical.
definitely.
When people started to play cricket, they didn't have helmets. So I believe those sports that has a potential of head trauma, boxing, the American football, that's been seen to.
And more you're seeing that they're improving because now in cricket, once you get hit on the head, on the helmet, you have a concussion substitute. So they take you off and you probably do whatever test they do and so forth. The same with rugby and American football. They improve
Yes.
because they would have seen a lot of guys who played those sports over the years as they get older, they lose their memory.
Very true.
So as you clearly said, the stats are there.
Yes.
Um, what are some of the signs we should look for? I mean, yes, losing your memory here and there, you might say it's coming out with age, or I got a lot on my mind, so I should be forgiven for forgetting something. But what are some of the clear signs that persons should be looking for, and when once they see those signs, they say, "Here, what? Let me go get a specialist opinion." When should we decide on that?
Well, we're going to look at the age of the person. We also look at whether in the families know that this condition can be there in the family. So if they know that it's already been established that grandparents had memory problems and dementia, or even died because of the consequences of dementia, then that would be one indicator that tells them, look, this forgetfulness may not just be benign forgetfulness of aging. You see, benign forgetfulness is forgetfulness that can, to some extent, happen inconsistently. But the problem with memory loss for persons with established dementia, especially Alzheimer's dementia, it's consistent. The deterioration is constant, and it gets more severe as time passes. So they would know that, look, this lapse in memory is not just a forgetfulness because there's stress or depression.
Yeah.
This is because the memory center is not working well. So it's consistent, and it also needs to be recognized very quickly because the person is putting themselves in danger. For example, they could light the stove or keep it on, or just turn on the gas of the stove and not realize that they left it on.
And
Without,
that's the area I was just gonna get into. That would have been my next line of questioning. How does it affect our day-to-day living? Once someone is affected by dementia.
well, early on, it's going to affect their short-term memory, so they will be forgetful about things that they should normally remember, like where did they put the keys, did they lock the door, did they turn off the lights or turn off the gas on the stove. So it gets worse as the dementia progresses to the point where they may forget where they were living, they forget their home address, they could wander outside and not know how to get back home, so there's a bit of disorientation that can occur. So it becomes more dangerous for the individual now to carry that condition without the support of their family or a medical care plan that will help to protect them and protect the home, because there is a danger of persons setting fire to their homes, and that's something that we have to look at very seriously in Guyana, especially as we have many of our houses are wooden structures and can easily burn down. So it's that consistent pattern of what we call gradually and progressive deterioration of the memory center, mostly short-term memory. The person that loses memory often knows a little bit that they are losing memory, and they tend to cover it up. They don't want people to discover that. Maybe they don't want even to know it to themselves. So they will not try. They will not try to make people know that. Look, I need help for my memory loss. They shy away from it.
And just makes it worse.
Yes, absolutely. So you really need to not confront them in a very aggressive manner, but to gently suggest to them that there's a need to do some checks. There's also a big problem with persons taking advantage of people who lose their memory, and
you're just like almost you're in my head, because again I was going to talk about financial and other forms of abuse
right.
of elderly persons with dementia. So you go ahead and elaborate on this one, because
Yeah.
we know people, unscrupulous people just signing away documents and the assets of elderly persons, especially when they're affected by dementia. But just
It's true. I mean,
yeah.
it's truly distressing to see families taking advantage of their older relatives and parents even, and then there is a dispute as to who has the right, especially if the older person didn't leave a will or make a what we call advance directives.
But they
So
will even make them sign documents that they're not even
yes,
aware what they're
absolutely.
saying.
So I've seen some cases where people had to bring their families in to be evaluated and to provide a report for the courts, and I don't say that's not important, but I think it's important that we shouldn't let the persons reach that stage. We should guide them and support them to making proper decisions when they're still within their senses to make those decisions, so that it's their right that is carried forward, and that conflict that happens between the family members is not there, because it's very distressing to see that happen. And I've had the experience of writing those reports, and I could see the problems that happen,
And it affects the elderly person a
and
whole
the
lot.
person, yeah, is sitting there and they're just bewildered and,
Oh, yeah.
and so uncomfortable as to what is happening here. Why there's a concern over my property, and am I not living in it? So they're very confused about it, and it's really not fair that should happen, as even in their lifetime. They're not passed on, so it's not that their will is now in effect. But I think one of the ways to move against that is to ensure that the person rights are protected, that they're evaluated properly, and that a decision is made as to whether they have capacity. So we as doctors, we don't determine competence, that's done through the courts, but we determine capacity. So whether they have the capacity for good judgment or they've lost their judgment, then they may not be able to make an informed decision. And we can guide the process, we can guide the families, and even to some extent support and protect the person who is affected.
And that is so important. But what treatment, if any, that is available for persons who are affected by dementia? Earlier you mentioned, like the B12 deficiency dementia is reversible. But, are there any therapy that someone with dementia can go through in order to improve or at least help to stabilize the memory that they have left without, allowing it to progress
Yeah.
further?
No, that's a very good question, and it's important. We talked about it before that the individual, has the best diet and maintains the vitamin B12 and other B vitamins, and but you get that in a lot of our foods, the vegetables, the fruits, and so on. So, I think a good diet is very protective. Having said that, if Alzheimer's is established, Ganesh, it's very unfortunate because, as I said, it's progressive. Those amyloid deposits are not coming because of lifestyle, it's coming because of genetics. And the genes are producing abnormal proteins, and these form plaques in the brain, like plaques that happen in the artery of the heart and so on. So we don't really go in and do brain stents as you do in the heart, but we are hoping that in the future they will be able to stop the progression by genetic therapy, and that's very advanced, and it's also in the process of research. So there is much hope for the future, but for persons now, the moment the medication that we use, the Aricept and Ezipil, they, they work by changing the neurochemical structure of the brain. So it increases acetylcholine, which is the neurochemical for memory. But it's a somewhat crude way of trying to restore memory. There's some advances now that we've found in the use of low-level laser therapy, which helps to improve the whole brain metabolic activity. It creates more antioxidant changes that are very protective for the brain. So that's
So
been
there,
done
there,
in,
there are a few options, and ones that are far ahead with research that
yes,
speaks well for the future.
absolutely.
Thank, thanks. Dr. Sharma, I want to thank you very much for sharing with the public. It was, really important information, and I'm happy that you've shared and it's now in the public domain. So we do encourage persons, if you're seeing certain signs, you're within the elderly age bracket or you're at risk, do get a proper diagnosis, before you make any conclusions.
Absolutely.
Thank you very much, Dr. Sharma. Thank you very much. This has been another edition of Disability and You. Do join me next time for Disability and You as we continue to share information on how the lives of persons with disabilities are affected. Thank you.